Dissociative Identity Disorder by Tina, Maya, Jessica, and Roman. Introduction. Dissociative identity disorder, also known as DID, is a mental health condition where an individual can have several separate identities or personality states, as described by the American Psychiatric Association. Each identity has its own thoughts, feelings, and memories. It's often a result from severe childhood trauma, and it affects approximately 1.5% of the population. This means it's much more common than we think, but it's not often talked about. People with DID have trouble remembering things, feeling connected with their own identities, and recognizing themselves. This can make it hard for them to live their daily lives, have relationships, and function in general. Even though DID is a known mental health condition, people often misunderstand it and judge it negatively. It makes it hard for people with DID to get help and support. So this quick video will go over the symptoms, causes, and treatments for DID with a focus on a specific therapy intervention and its strengths and its weaknesses. Background
information. Dissociative identity disorder, or DID, is a rare and intricate psychological condition affecting approximately 1.5% of the population. The Diagnostics and Statistical Manual of Mental Disorders, DSM-5, outlines specific criteria for diagnosing DID, including the presence of multiple distinct personality states, recurring memory gaps, and significant functional impairment. Often misdiagnosed, DID requires thorough assessment and accurate identification and is frequently associated with self-injury and suicide attempts. The history of DID dates back to the 19th century, with documented cases referred to as double consciousness or double personality. It wasn't until the 1970s that DID garnered attention within the psychiatric community, undergoing evolving perceptions and diagnostic challenges. The first documented case of DID was Mary Reynolds in 1815. Her condition was described as having hysterical fits. Mary could sleep for 18 hours a day and wake up with memory loss and functional impairment. She also herself acknowledged the fact that she did have two altered states of being within herself. Despite initial skepticism, research and clinical experiences have validated DID as a genuine disorder, commonly stemming from severe childhood trauma. Treatments typically involve psychotherapy and other therapeutic interventions. However, despite advancements in understanding, DID remains widely misunderstood. Stigma and misconceptions still surround the condition. This underscores the ongoing necessity for education and awareness initiatives to support individuals living with DID.
Characteristics and symptoms.
Dissociative identity disorder, previously called multiple personality disorder, is characterized by the presence of multiple distinct identities or personality states within an individual, as defined by the American Psychiatric Association. These identities, referred to as alters or alternate personalities, exhibit unique ways of thinking and interacting with the world, including differences in names, ages, genders, and other characteristics. Individuals with DID may experience sudden and involuntary switches between these alters, frequently triggered by stress or traumatic events. Common symptoms for people with DID include significant memory gaps, feeling of depersonalization and derealization, as well as confusion about one's identity as defined by the American Psychiatric Association. Some individuals with DID may experience co-consciousness, which is when certain alters have awareness of one another and can communicate with others internally, as outlined by the International Society for the Study of Trauma and Dissociation.
Causes.
Dissociative identity disorder is often associated with severe trauma, particularly in childhood, such as physical, sexual, or emotional abuse, as highlighted by the American Psychiatric Association. This trauma is a catalyst to the development of dissociative symptoms and the fragmentation of the individual's identity. Individuals with DID may also present with other conditions like depression, anxiety, PTSD, substance abuse, or eating disorders.
causing DID to be a complex mental health disorder to both diagnose and provide treatment for. DID can significantly impair daily functioning, affecting work, relationships, and self-care. It remains a complex and controversial diagnosis, with ongoing debate among mental health experts regarding its nature, etiology, and treatment approaches. Thus, obtaining a diagnosis and a treatment plan from a mental health professional experienced in dissociative disorders is crucial.
Therapy treatment.
There is no official, evidence-based guideline to treat dissociative identity disorder due to the lack of research. However, experts believe that a combination of treatments and therapy plans work best. Psychotherapy, such as cognitive behavioral therapy and dialectical behavioral therapy, is one of the main forms of treatment for dissociative identity disorder. The goal of psychotherapy may differ from case to case, therefore the treatment plan may be adjusted to fit the individual's unique needs. Typically, the goal of psychotherapy is to improve the individual's quality of life, relieve the stress and symptoms, and allow the individual to adapt and function while living with the disorder. Psychotherapy can do this by helping to integrate one's different personalities, find the underlying cause of the disorder, help the individual process and cope with any trauma, provide education, or find ways to manage triggers and emotions. In many cases, education and treatment extends past the individuals themselves. It is important that the family and friends receive education on dissociative identity disorder to better support the individual who has been diagnosed. Whether it be through researching it on the internet or joining in on a therapy session or two, family and friends can learn about how to prevent triggers, address self-harm, suicide prevention, how to interact with the individual, and even just to listen. Cognitive behavioral therapy is the most common type of therapy used to treat dissociative identity disorder. It can be used to treat a number of symptoms that are associated with the disorder, such as negative thoughts, help manage stress and emotions, and reduce the symptoms that are related to depression and anxiety. This type of psychotherapy can help the individual to make healthy behavioral and mindset changes to improve their quality of life and well-being by assessing their thought patterns. Dialectical behavioral therapy is based on cognitive behavioral therapy, but it has been adapted to focus on individuals who experience more intense emotions. This type of therapy can help the individuals accept the reality of their disorder and teaches them to make healthy changes to adapt to it and move forward. There's a prioritization on reducing suicidal or self-harm thoughts, regulating emotions, and increasing mindfulness. Treating anyone with dissociative identity disorder can be difficult and requires careful planning, therefore treatment is best done in a phased approach to ensure that the individual is not too overwhelmed. The main focus throughout the treatment is stability. Therefore, the timeline of the treatment can vary depending on the case, but it typically lasts several years, which is much longer than any other disorder. Phase 1 focuses on the safety and the stability of the individual and aims to reduce any suicidal or self-harming thoughts as they begin to express their emotions, feelings, and thoughts. During this phase, the individual may learn new coping techniques and begin to accept that their feelings, thoughts, and emotions are completely valid and are a part of who they are. Phase 2 focuses on identifying, addressing, and processing any past trauma the individual may have. During this phase, the individual may begin to have a better understanding as to why they dissociate and what triggers them. Phase 3 focuses on the individual incorporating their newly learned skills to manage their emotions and triggers, as well as cope with their trauma so they can live their life without having to rely on dissociation. Although psychotherapy can be very beneficial to treat individuals with dissociative identity disorder, it can be extremely dangerous if it is not done well. Going through old memories, feelings, or trauma can re-traumatize the individual, which can cause them to go into a relapse. This can also cause one or more of the personalities to turn defensive and protective as they may feel threatened or endangered, which can delay or even stop the treatment.
Effectiveness of treatment. In a study done by Stephen Kellett in 2005, he created a paper called The Treatment of Dissociative Identity Disorder with Cognitive Analytic Therapy, Experimental Evidence of Sudden Gains. The study aimed to evaluate the effectiveness of cognitive analytic therapy as an intervention for dissociative identity disorder. The results of the research were assessed through three main objects. One is the impact of the intervention on the state dissociation using experimental measures. Two is the effect on identity shift frequency. And three is the overall effectiveness on general mental health, state and trait dissociation, and personality structure through psychometric evaluation. Now, you may be wondering what state dissociation is, and it is the separation or detachment of certain mental processes or aspects of consciousness from the individual's usual awareness. Results. When looking at state dissociation, they used a schema dialogical repertoire, which is a method or set of strategies involving dialogue and communication to address and manage certain psychological conditions. In the experimental measures in graphs 1, 2, and 3, it indicated a general pattern of reductions in state dissociation over the intervention period, with evidence of sudden gains following the reformulation letter and the schema dialogical repertoire. These reductions were maintained and in some cases even enhanced during the follow-up period. The patient's use of schema dialogical repertoire for self-reflection and symptom management suggests continued benefits post-intervention. When analyzing identity shift frequency, it looks at how often they experience a shift in their identity or their main personality. And it also looks at amnesia, which is memory loss. So in graph 4, it demonstrated a consistent increase in the number of identity shifts perceived by the patient across both the intervention and follow-up period. This suggests heightened awareness and reduced amnesia for identity shifts due to the intervention, potentially indicating progress in integrating self-states. When analyzing the other tests that were done, such as personality structure questionnaire, there was a significant and clinically meaningful reductions in fragmentation between assessment and termination. In the dissociative experience scale, it revealed a notable decrease in trait dissociation as the patient reached a level below the cutoff point to severe dissociation at the end of treatment, and there was no relapse observed during the follow-up period. In the Beck Depression Inventory, it was seen to have clinically significant reductions in depression scores. And lastly, in Brief Symptom Inventory, it revealed significant reductions in depression and general psychiatric symptomology. The data supports the thesis that stated cognitive analytic therapy would reduce the intensity of state dissociation experimental measures, and that cognitive analytic therapy would have beneficial effects on trait dissociation, personality structure, and the general aspects of mental health. This study indicates that cognitive analytic therapy intervention results in reductions in state dissociation increased awareness of identity shifts, and positive effects on comorbid mental health issues. The sudden gains observed at key intervention points suggest that cognitive analytic therapy tools play a crucial role, possibly in conjunction with a secure therapeutic relationship. Now, although there is a lot of positives to this study, it is really important to consider the critiques as well, as they need to be considered when analyzing the information from this research and determining if cognitive analytic therapy is the best therapy for dissociative identity disorder. So some critiques for this study is the lack of generalizability due to the lack of information on the sample size. There's a lot of missing details about the participants' baseline characteristics missing from this study. There's also missing details about the intervention itself. And some of those details that are missing are like what is said or what they did. So providing more information about the intervention process would really enhance the study's transparency. Additionally, there is a very short follow-up period, which really may underestimate the long-term effectiveness that all the results showed. This study also briefly mentions a comparison with Fine's technical integration model, but does not really delve into a detailed analysis of what this is. So I think for future research, having a more comprehensive discussion and critical evaluation of how cognitive analytic therapy compares to other potential treatment models would really be valuable in determining what is the best therapy for dissociative identity disorder. There could also be a lot of bias in this study, although there is a lot of clinical evidence supporting the diagnosis of dissociative identity disorder. The therapist providing the intervention also participated in the assessment. So, independent validation of the diagnosis would really strengthen the study. Cognitive analytic therapy demonstrates promise in treating dissociative identity disorder, but addressing sample size, baseline characteristics, extending follow-up periods would really enhance the reliability, as well as making sure there's no bias and making sure that there's some kind of comparison would really enhance the evidence. So future research should aim for a more comprehensive understanding of cognitive analytic therapy. Example:
Dissociative identity disorder media portrayal. An example of media portrayal of DID is the psychological thriller film called Split. Its main character, Kevin Wendell Crumb, has DID. While the movie has a very suspenseful storyline, it has been widely criticized for its inaccurate portrayal of DID. In the movie, the main character with DID exhibits very exaggerated symptoms, including having 23 personalities, some of which possess superpowers. This portrayal spreads misinformation about the disorder. In turn, it reinforces the stereotype that individuals living with mental health disorders are dangerous and unstable. Additionally, the movie fails to depict all the trauma and distress that individuals living with DID experience, as well as the challenges they face in their daily lives and the importance of seeking support. For these reasons, viewers may come out of the film with a distorted understanding of DID, leading to fear and discrimination against individuals with the disorder. Split is one of the most recognizable portrayals of DID in popular media, but it has missed a great opportunity to educate the general public on the condition. As a result, most viewers are less likely to support those living with DID. Overall, while the movie is an entertaining thriller, it does not accurately depict DID. The media needs to use accurate information and focus on empathy and education to combat stigma and promote understanding when portraying mental health conditions.
Conclusion:
Dissociative identity disorder is a serious mental health condition that involves having multiple distinct identities or personality states inhabiting one body, each within its own experiences, thoughts, and behaviors. It's not as simple as commonly thought or as exaggerated as it is in the media. It often stems from severe childhood trauma and can cause symptoms like memory gaps, feeling disconnected from reality, and trouble understanding who they are. Understanding DID is crucial to increase our empathy and compassion towards individuals with this condition. By recognizing the complexities of DID, including its symptoms, causes, and available treatments, we can reduce the stigma associated with it. This awareness can create a supportive environment that promotes the well-being of individuals with DID. As advancements in mental health continue, it is essential to provide empathy, comprehensive care, and individualized support to facilitate recovery and a deeper understanding of this condition.
Thank you for watching, and I hope you learned something about dissociative identity disorder.